I'm very happy to introduce both Monica Pecha and Lana Tyer. Monica is the TB controller and program manager for Washington State. She has been with the Washington State Department of Health for less than a year, but has over 8 years of experience in TB epidemiology. And Lana Tyer is the TB nurse consultant with the Washington State Department of Health for the past 3 years. She coordinates the TB Echo Session, which, if you don't know about it, is a telemedicine learning community that offers case consultation and didactics for TB infection and disease. So I've also heard some questions about reporting, and this is the perfect the talk to follow up with that. I would also like to say, let's try and save our questions for after the speakers have finished their presentation. We've tried to build in plenty of Q&A sessions so that you can get your questions answered, but I do appreciate your waiting until the end for asking questions. Monica and Lana.
Thanks, Rena, and I'm Monica. This is Lana. We're actually going to start by a couple handouts we're going to pass out to you. One of them you need a magnifying glass to read, but yeah. So there's on the other one there's actually a link to it, so you can go on the website or you can blow this one up. So here, I'll separate these in two. Thank you. Okay, and actually when I originally printed it, it printed this large, so apparently there's no in between. It's either magnifying glass or giant sheet of paper. Okay. So as Rena said, I am the TB program manager and TB controller for the state of Washington. And I'm going to talk to you about reporting. I'm going to briefly just talk about active TB disease, and then we're going to talk about latent TB for the majority of this presentation, this brief presentation. So this actually is the healthcare providers notifiable conditions list. This is posted on the state of Washington's website. And I've highlighted tuberculosis there. This is the current form. We're actually in a process of revision right now. We expect changes at actually late 2020. We expect a few changes to these. One of them around tuberculosis is it's our wording. It's basically the same requirements. We're just trying to be a little more specific with them, saying that if you have tuberculosis disease confirmed or highly suspicious, meaning initiation of empiric treatment. So that really overall, this is not changing. If you see someone where you suspect active TB disease, that is reportable. Let's see, and I think Joanna covered the applicants with clinical signs or symptoms of suggestive TB disease or known HIV infection must also be referred regardless of the IGRA result or chest radiograph findings. And then all applicants with extrapulmonary disease must be referred to the health department for further evaluation as well. So with latent TB infection, the first paragraph up there is just highlighting the definition of LTBI for us. And then the recommendation is that you're also letting the applicant know that you're referring them to the health department. And this is, again, required for you to report to the health department. The applicant's name, contact information, IGRA results, and chest X-ray results must be reported to the local health department of jurisdiction. And again, we're just trying to re-emphasize a few things over and over today, so hopefully they'll sink in. Documentation of prior diagnosis and treatment completion for LTBI still must have a chest X-ray and evaluation. If the chest X-ray is negative and the applicant does not have signs or symptoms of TB disease or known HIV infection, the applicant does not have to be diagnosed with LTBI or reported to the health department and can be classified as a no Class A or Class B TB, which I think is consistent with what Joanna has told us, and please interject if I've gotten something wrong. So one of your handouts, has everyone gotten a handout now? Okay, awesome. So your first handout, you see that blue sheet, the really tiny one. This is a list in Washington for all of our health jurisdictions. It has your phone numbers, your fax numbers, and websites. So again, you can find this online. It's going to be a little more readable probably than your handout. But this is the information. So when you're reporting, you need to report to the applicant's residence. So you actually might be seeing someone who lives in a different county. It's reportable to the county where they live, not the county where you work. So just to make that point. Also, if you go to the Washington State Department of Health website, there's a link where you can find additional information. You can actually go to the websites for the different counties. In Washington, we call them local health jurisdictions. Most counties are their own local health jurisdiction. A few counties are actually grouped together. So you'll be able to find that on the website. Okay. And the last thing that I'm going to talk about is just the reporting form. So I actually created this slide maybe a week and a half ago, and in the past week and a half, we actually have come and created what we're standard reporting form, and that's the other form that you have. So some of the counties might have, and I think Tacoma Pierce has their own reporting form, but this is the form that we're providing our local health jurisdictions to report to you. This is now posted on our website as of yesterday, so you can go to our website, which is the Washington Department of Health Tuberculosis. If you Google that, you'll find us. Right now, it's a featured resource, so it's on our first page. You can also dig in a few additional places. We've got it posted a few different locations. And it'll tell you exactly how to report and what to report. So in addition to this form that's filled out, which again, we're not asking for a lot, just a few basic pieces of information, you'll also need to attach a copy of the test results, either the quantiferin or the T-spot that you're doing, and also attaching a copy of the chest radiograph. Not all jurisdictions are necessarily doing anything with these reports, and we recognize that, but we are, as a state, saying that this is required. Technical instructions are saying it, and we're supporting that, and we really want you to report to those jurisdictions. If you have any questions about the form, again, we just finished this. We know that some of our counties will be adopting it, and we're hoping that most all counties will adopt it. So make it easier for you, so you can look at one form and not have to worry about which county am I reporting to, which form should I be using. So this is just to help them. So you might be seeing this coming up through fax, reporting this. If they have special instructions for you, again, please work with them if you mainly work with a single health jurisdiction. But overall, as a state, this is what we're asking and what we're going to be working with our jurisdictions on using. So thank you.
All right. TB consultation. Is it TB or is it not TB? I am here to help you. And it's a beautiful question. It keeps me learning every day. So don't expect to know the answers, because then it wouldn't be fun. So there's lots of consultation available to you. The first and foremost, we'd like to highlight our partner in creating this entire training, Curry International TB Center. They have a warm line. Warm line means that you leave a message and someone gets back to you in, I think it's two days, right? 2 days? Yes. Okay. Sorry. 2 days. And here I have listed for you the phone number. And then option 2 is to send an email to currytbcenter@ucsf.edu. Can't get much simpler than that. And these are TB experts that you'll be connected to, many of which are in Washington already too. So the other way of getting TB consultation that will be specific to our state is contacting the county of the patient's residence. There are a wealth of TB experts at your fingertips in your counties. I am constantly impressed. Many of them are my mentors. So these TB nurses have been seeing patients for 15 plus years. They're amazing. Definitely get to know them. You now have a list of how to contact them. Then there's me and Monica Pecha at the state. Here is our general TB services phone number. I have cards if you need them. I'd love to hear from you, actually. And then I would love if I had at least like Monday. I have one case. I need another case. Give me another case for TB Echo from Monday, right? Like I would love to take all of your case consultation and have it all taken care of on Monday in our web conference. Okay, it's like the Brady Bunch. It opens like the Brady Bunch. You see everybody in these little tiny Hollywood squares, okay? You can see everybody. You're eating lunch, you're multitasking, we understand, you're probably at work. It's every Monday from 12:30 to 1:30. You contact me, you give me your cases, and then I put you in the queue, and you have a wonderful panel of experts. Dr. Scott Lindquist, you heard him today. Dr. David Horn, you'll see him in a few minutes, and Dr. Masa Narita, he is our King County TB controller. And then there's lots of other expertise in the room as well. So we are into democratizing medical knowledge. So creating a learning environment where providers bring cases and we talk about them and we work through the questions together. We also have regular didactics. We're actually restarting our didactics to do a little bit of a latent TB infection 101 starting at the beginning of the year. So that would be great. Let me know if you would like more information and or you can sign up yourself. So if you just search TB Echo, the first thing that comes up will be our Washington State Department of Health website. You just click on an Enroll Now button. You'll receive our invites every Monday morning. I also do a brief case summary, so you'll even see what cases we're going to talk about that day to see if that's of interest to you. Like maybe you're more interested in pediatrics, or maybe you had a really hard pediatric case recently and you're really interested to engage that. So we welcome as little or as much participation as you can possibly do. Just another thought about TB Echo. So a lot of our providers are there pretty regularly. A lot of the local health jurisdictions, their nurses, their health officers attend regularly. So it's a great way to see the people you've been talking to on the phone for years, perhaps. But one of our participants said, this is perhaps the most valuable continuing education experience I do. It is so relevant to the work that I work to prioritize TB Echo meetings. I feel I learn at least one or two new things each time. I really appreciate the diversity of experience and perspectives. It is a great resource. So we have really engaged awesome people to talk to about your cases. So you're not alone. That's really the bottom line that I want you all to know. TB is complicated and we're here to help. And one of the main people that you'll get to talk to just walked in the room too. So, all right. Done.
Documented treatment. What's your understanding of that?
So typically for those, it kind of depends. So if it's historical, undocumented, they basically have to get another IGRA, unless they have like a history of a positive IGRA. Right. Oh, right. Yeah. So if it's really, so typically we say these are rare cases. So I think, so in the past year, they were treated by the health department for LTBI. Oh, okay. Right. No, they need an IGRA because they would have had a TST. They need an IGRA if it's positive. They have to get a chest X-ray. They could, because again, they could have active TB again, or for the first time. If they had a TST in the past, if they had a positive IGRA in the past, they go straight to chest X-ray.
And that was consistent. So the one of the slides, documentation of prior diagnosis and treatment completion for LTBI still must have a chest X-ray. If they don't have that documented QFT, they'll need the QFT as well. But if the chest X-ray is negative, or you had a previous QFT documented, that would not need to be newly reported if it's not the new diagnosis. If you had a previous QFT. I'm sorry, can you say that again? That's a recommendation that we would let them know, so that if the health department decides to reach out to them, some health departments will, some won't, for follow-up. I know some are looking at, the risk of the individual to determine if they want to call them in for treatment or not, or refer them. So just as a heads up, so it's not a complete surprise to them, we'd recommend and we would request that you do that, but that's not required to notify them that they're being reported. Correct. Yes. 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 Yeah. Yeah.
So we're talking about the civil surgeon form, but it specifically states you have to do an IGRA on everybody. You can't go straight to a chest x-ray. So are you sure? Because at least the last time I read it, it said you have to have this first.
Joanna, do you want to clarify?
Yeah, I mean, we specifically say in the technical instructions, if they have a documented history of a positive IGRA, they can go straight to the chest x-ray. If they have a positive IGRA. And I think there's even, I'm not the most familiar on the I-693, I think there's a block for history of positive IGRA. But definitely in the technical instructions, it clearly states if they had a positive IGRA, they go to chest x-ray.
X-ray. Okay.
So I'm just reading there, it's documentation of prior diagnosis, treatment completion, must have a chest x-ray. If they've had a chest x-ray with their PCP, is there a time frame that chest x-ray has to be done? For example, if they were just treated for LTBI with rifampin for 4 months, they probably had a chest x-ray before they started treatment. Can that same chest x-ray still be used for the purposes of?
I'd probably refer back to Joanna again. Yeah.
So typically no. So if we're not, it has to be part of the civil surgeon process. The only time we make exceptions to that, if it is the health department. We've had people who just got a positive IGRA from the health department. They're on an LTBI treatment. The health department has, a chest x-ray that's negative from a week ago. Then the health department can speak to the validity of that. But no, private providers, it has to be repeated. It doesn't always make, complete perfect sense, because again, it's a screening process that has to be fair to everyone. So we can't vouch for the validity of various private providers throughout the world and throughout the US. So it has to be within the health department system or within the civil surgeon system.
Thank you.
Monica and Lana, thank you very much.